of ZoeTv.
It has been a while. As you can tell from our start, we were can't believe we're together finally.
I know. And we've both really battled through some things.
We've navigated, and yet here we are.
And here we
can't
are.
Stop us.
And what a perfect first show.
We could have scripted this any better.
We could not.
An expert.
And we did plan it, but had no idea.
It's amazing.
And her timing helped us because she wasn't available when I first asked.
Okay.
So this is better.
Well, we got to start because we only have...
We do. Okay. I need to tell you how important this person is in our life, in the life of home care, nursing care, skilled nursing, infectious disease. We have the honor to introduce to you again. She was on our show 2 or 3 years ago.
And we did it in the Performance Center.
Yes.
We had to bring it live to the actual physical aspect of COVID.
And we should actually air that one again too, just sort of to let people know. But anyway, with no further ado, welcome Buffy Lloyd Krejci. Krejci.
That's why I let you do it.
We changed her name. Okay. Welcome.
Thank you so much for having me. Really, it's an honor to be here, and I'm excited to speak with all the residents again and your community. It's a great time to be here with you guys.
Well, and you tell everybody your background, how we even got connected.
Right.
Because you were on this campus making a huge difference in a really scary time.
Yeah, I have a background. I've worked in healthcare for it's almost 30 years now. I won't tell my age too much, but in various roles. But my specialty and my education is epidemiology and infection prevention. And I started working in the nursing home, specifically that industry, in 2016 with the quality improvement organizations helping nursing homes report infectious disease data into the CDC. And then I started my own company because I saw such a need to help nursing homes reduce infections in their buildings before COVID.
Yes.
And I just wanted to focus on that. So that's been my passion. I was helping Glencroft with their infection prevention and control program. That's how we met. And then, of course, the pandemic. The pandemic changed everything for everyone.
One of the takeaways I remember, we just talked about it, was the first time we connected and we talked on the show was your illustration of this is your passion for so long, and it finally got to the forefront with COVID, and you had this entire desire to bring what you do to all of the different spaces in senior living. And COVID kind of let you have that opportunity, unfortunately, to really...
Across the country.
Yeah.
Right. So I really was focused on advocating before COVID, because what people don't realize is the statistics demonstrate that about 1,000 people a day are dying from infections in our long-term care industry across the country. And this was before COVID. When I heard
that is what? Are you talking about flu?
We're talking C. diff, pneumonia, skin and soft tissue infections, UTIs, pneumonia, these MRSA, these multi-drug resistant organisms. These are infections have been running rampant in our long-term care facilities, and the estimates, like I say, 1 to 3 million a year is what the estimates are.
Wow.
And then they contribute to about 380,000 lives that are lost. And so when I heard that and learned of that, I said, we've got to do more. But I didn't feel there was a whole lot of attention for long-term care on how to fix it. And so that's really what started my passion of I've got a big voice, a big personality, and I'm going to go out there and try to do something about it.
That's awesome.
But being one person, you only can do so much. And so really over the last few years, and especially with the pandemic, I've worked with Doctors Without Borders. I'm working with different states and their counties. And so really being able to help more of the collective, which is definitely my desire.
Well, because we are a, senior living campus with a skilled nursing and assisted living and independent living, and nobody wants these diseases or illness. Tell us what you've learned, what you know, and what you could teach us still.
Right. So what's interesting to me, and this is, I remember our conversation before, and actually some of the things we talked about before are still very relevant to date. Up to 70% of infections are preventable in our healthcare settings. And when we stop and pause and think about that, we're like, okay, what are we doing and why aren't we preventing them? And so when I go into nursing homes or the different long-term care facilities, I initially look for the very basic practices. How are we doing hand washing? Do we have access to alcohol-based hand rub? How is the environment being cleaned? How are we wearing appropriate PPE? All of these things really do make a difference. So some of those basic practices that as an individual, let's say I'm a nursing assistant or a physician, anybody, and we're working on the floor, we think, I'm one person. What harm can I do? But really, if we're not doing those basic practices, we're just sharing the love of the bacteria everywhere we go, or the viruses, you know, and it really, really is true.
Now, have you seen a change since COVID and since the awareness in what you've done? And then we'll talk about your book.
Yeah. Well, unfortunately, and we're not out of this pandemic. We, in our communities, we have opened up. We are living life as it's normal. But in our long-term care settings, I mean, I was just in Minnesota last week. I was in 8 buildings, and half of them had outbreaks of COVID. You know, so I'm still very much seeing the effects of this virus in the long-term care. And we also have a bigger problem right now, and that's we have a huge staffing shortage.
Right.
So our staff we're very fatigued. We've been doing this for a while, our healthcare providers, so many have left the industry. And so we have a very severe staffing shortage where people are just trying to get through the day. And so to answer your question, we are all aware of the infections that we have in our long-term care settings, but we can't totally put our focus on prevention practices fully until we can solve our staffing and we can get the people in the building to do what we need to do as well. So there's multiple factors.
Have you seen a difference, because you do travel and you're able to see so many different buildings in so many different parts of the country, are we better than we were pre-pandemic in how we are across the board approaching infectious disease? I know it's a big question, but
what I see is we've gone to war, and some of our soldiers are coming back and they're healing, and so we're not in normal practices quite yet, if that makes sense, you know? And so I don't know if it's getting quite better yet. There's more of awareness. We had awareness before, but always implementation is what is challenging. And during the pandemic, during the height of all of this, it's like we're just trying to survive this crisis, right? And so now we're kind of in the aftermath for some part. I mean, some people are still in the middle of it, like I just mentioned, but we need some healing, and then we just need support. I mean, if there's one message anybody can take away from this visit today is our long-term care facilities need support, and they still need a lot of assistance.
Yes.
Well, I will say, you know, COVID took the forefront of so much of the conversation. And did you see, because you're such in the trenches with it, was there a decrease in a lot of the other bacteria that was floating around, or flu, or because there was so much attention to being sterile? And did you see a decrease, and is some of those coming back, or how does that
Good question, yeah.
We're still tracking all of our infections. There have been some reports that have come out showing certain infections. We saw an increase in, more specifically in the hospitals, where they do more reporting than we do in long-term care. They saw increases in certain infections that maybe because they didn't have the prevention practices like catheter-associated infections, C. diff, certain healthcare-associated infections that they usually have a lot more focus on. And then when that attention got diverted strictly to COVID, we've seen some of the increase in those infections as well. Long-term care, I'm not entirely sure on because we don't collect that data like we do in the hospitals, and that's another one of our issues with actually preventing infections is we don't really have a national system. We have the system, we're just not reporting into it collectively to really understand the true burden of all of our infections.
Interesting.
And so back to the COVID question.
Yeah.
We're not out of the woods.
No, I mean, I think that what's challenging, especially in our long-term care, our healthcare workers we still wear our masks, our N95 respirators, our gowns, our eye protection. If we're in a high transmission, and even the healthcare workers, we have a different transmission level as far as what we need to do to operate than even the community does.
Right.
And so the community level, it may look low, but based on hospitalizations and deaths and other factors, we may be operating as though it's still high. So we're still wearing all the same PPE, practicing those preventative measures. And so that can be challenging because you have visitors coming in and they're like, I don't have to wear a mask out in this community. Why do I have to wear one here? But we have to remember this is a vulnerable population.
Yes.
We have residents with high comorbidities, and we need to protect them even more. So that's why we're still operating, because COVID is still circulating in our communities. We have different variants, and so we need to still practice those measures, practice the hand washing, wearing face masks when we're around people as much as possible. Especially what I would say to the viewers is if you are symptomatic at all, to put on a face mask.
Yes.
Because what I'm starting to see is people in the community that may be coughing or sneezing and they're not wearing a face mask. And, that's a simple measure that can protect people around you.
Right. And I know with our skilled nursing, they're still very adamant. You can't go in. Most of us can't really go in unless you have a purpose.
Right.
And you do have to wear masks. And they wear masks everywhere on campus.
Right.
If they leave, they still have their mask on and goggles. And because you're right, they don't walk out the door and go, oh, well, now I'm in free territory.
Right.
They know that is really important. And I'll tell you, I had that when I heard they no longer requiring masks in planes. I'm going to be somebody who will wear them. I think if there was ever any place I could pinpoint that I got sick, it was in a plane.
Yeah.
You're this close to somebody you've never met, and they're breathing on you and leaning over. And I know people were so excited. I get that. It's annoying, but I'll be one of the ones that wear it. Me too.
I was disappointed, and to be honest, because I travel a lot, and I've been on the plane recently since it was lifted, and I'm still wearing a mask. And I hear people coughing and sneezing, right behind me, and I'm just like, oh, thank God I have a mask on, because I've not had COVID, and I do not want to get COVID. And I mean, there's symptoms that can occur. My daughter, she's 28 years old, and she had COVID in September. She still has long haulers, so she still has symptoms. So even though people may have mild symptoms, it can affect them long term. So we really do, especially if we're not feeling well ourselves, to be courteous and considerate of other people. Wear that mask, socially distance, stay home if you want, because it still can cause a lot of harm for people. This virus, it can.
Well, and the things that you and I have gone through, I don't know how you feel about flying, but I want to be that, oh yeah, I don't need the mask, it's annoying, but that is one place I think, why did we say no masks?
I know.
I think it would keep people from getting everything. I mean,
Well, and I'll just speak frankly, before COVID, I would wear a mask. And I know really wearing a mask protects more of the people around you, but it does offer some protection for you as well.
Did you say that again? My apology.
And I would wear a face mask during flu season. And I remember I was the odd one. You know, people would look at me like, what are you wearing a mask for? But I would never get the flu. And the times years that before I did that, I would get the flu if I traveled on the plane. So
yes, me too, or a cold.
Right. So, I mean, it's definitely, it is a personal choice, and but my guess plea to people is if you're not feeling well, and what's very important to know is that the tests that we take to know if we have COVID, like the antigen testing, the ones you buy over the counter, they can take several days to turn positive after symptoms. So especially like with the Omicron variant, there were many people would take 4 to 5 days after symptoms before that even turned positive. So here you take it maybe day 1 and you're like, oh, it's negative, I don't have it, when you really could have. And it's also not as sensitive as our PCR test, and so it's not 100% accurate. So even if your test comes back negative, you can operate as though obviously you have something going on, even if it's not COVID. And so to protect other people, I just think it's considerate.
I think going back, I think the testing from the start to even now has been the hardest thing to get over. Okay, I tested, I said, but I could have picked it up, and next minute I walked out the door.
Right,
like
exactly.
That's the hardest
piece. One point in time, right? And so we use, even in the long-term care, we're still testing.
Yes.
If you're not up to date, if you don't have boosters, we're still testing you twice a week.
Right.
And the reason we do that is exactly what you just said. We could be exposed, and then maybe it just it hasn't had a long enough time to have that test turn positive. And so it's just good to protect our community to do that ongoing testing.
Well, I know I just spent, unfortunately, and everybody out there knows, 12 days in the hospital with C. diff, and the emotional side of having something to isolate you, and especially in that building. And that's where I kind of want to find out what your impression is, because we'd worked so hard with ZoeLife to try to get our population in AL and skilled socializing and and activities and being thrown, because I'm a people person, to get in a room by myself, and when someone comes in, they're gowned up because it's so contagious. And I had just this little experience of being solo and not having that people and being able to touch on people, and I had to be quarantined, and I understood it. But what's your thoughts of like moving? How do we bridge that gap of safety first, but still checking all the boxes of emotional stability and like being able to do all that? How do we do that?
Yeah, what you describe is definitely one of the reasons I do what I do too, is because, when we have an infectious disease and we're in healthcare, that's exactly what happens. We get isolated. And then, when we have a healthcare worker comes in, you can't see their smile or their eyes. It really affects our psychosocial needs. And so we want to reduce that risk as much as possible, right? And that's why some of these practices are so important. As far as balancing it, that's why I'm saying it's really about individual responsibility too. I'm such an advocate for our healthcare workers. I was just training in ACA yesterday, their Care Force Academy, and 18 certified nursing assistants, and it was like I kept talking about the basic principles of infection control, because they never go away, and the importance of hand hygiene and the importance of socially distance if that's appropriate. But I think that we have to take ownership ourselves. And, if we're not feeling well, stay away from other people, and communicate that. And I think, we have to consider the consequences of what us being sick could do to somebody else,
I just think that's where we're going to be now, and this next step forward is how do we bridge that gap? Safety, but get connected again.
Get connected. Well, and I know, I wonder if there's any study or anything that was said about this, because when I've been to Japan years ago, 15, 20 years ago, they wore masks then. If they were at all not feeling well, they wore masks, and it wasn't uncomfortable. I mean, it felt weird.
Well, they do it for pollution too.
Yes. So my question is, because they've done that, and did they have less? Do you know?
I don't know. Because I've thought of that too. But I mean, they're struggling right now, like in China with their outbreaks. You know, that's a whole thing. But I know that it definitely helps reduce the spread.
Right.
But I also understand. It is nice. We're sitting here. We can see each other's faces, our smiles.
Yeah.
Like, if I have people that meet me now.
Excuse me. Sorry.
Oh my gosh.
I know.
I have people
All
that
choked
meet
up.
me now that only knew me garbed up in PPE, and
Yeah.
they're like, "Oh my gosh, I didn't even recognize you."
Right.
And so
I have to say, I had to go, oh,
Yeah.
that's her.
That's Buffy.
Yeah.
Yeah, so I just think that there is a balance. I understand from a psychological perspective why we need to do this too. So yeah, I think there's this balance, and it really comes down to the individual. Like, we don't have to wait for our government to mandate
Right.
a mask,
Yep.
to wear a mask and to protect other people. You know, like, let's be accountable for ourselves, and because only you know you, and if
I
you're not
know.
feeling well,
Right.
And
do you know what I
hope
mean?
we
We're
get
not
to
a country
point.
that thinks people should stay home when they're sick.
No.
They think you should work through it and show up.
Exactly,
You only
that's
have a
it.
certain amount of PTO.
Right.
Right?
You're right, and I hope we get to a point where somebody is in a mask on a plane. It isn't automatically a political thing. It's automatically not
yeah.
a fight. It is, you know, they must have something going on. They're compromised.
protect me.
Yes.
Yeah, and it's just simple. It's not this
Yeah.
agitated state that this has become, where
Yeah.
it's just like, oh, he's doing him, right?
Yeah.
Like,
Well, you don't
Right,
know
good
if they're immunocompromised themselves. You don't know if they're going through cancer treatment.
You don't
Right.
know.
You don't. I mean, really, it goes down to basic love and kindness and
That's right.
tolerance, and
Yeah.
really for each other, right? And so this virus is still very active in our community. Here's the thing: it is a global virus, and so until we contain this virus globally, it will continue to circulate. It may be here forever at this point because it is global, right?
Right.
So we need to respect it. It's not, to me, it's like, it's about the virus. That's why I got into studying infectious diseases, because it's like there's so much respect for what these viruses and bacteria do.
Ugh.
It doesn't matter what political side we're on.
No.
The virus or
No,
bacteria
right.
is going to do what it's going to do.
Right.
And so we have to understand that and really take responsibility too.
Well, on that chart that I saw about the 1,000,000%, I also saw the scale and the difference now that we have the vaccine and the booster.
Of course.
And I still am surprised at people that don't think it works because they know somebody who had the vaccine and still got it.
Yep.
When in actuality, that happens, but way less.
Well, what I'll tell you of what I know, and I'm not an expert in vaccines, but what I will tell you is that, even from my own experience, and we see this in the data as well, in the nursing homes, a year ago, so I would say, the end of 2020, before we had the vaccines, there was a higher percentage of residents who got COVID that were hospitalized and died. Just that is what happened.
Yes.
And then in the end of 2021, when the Omicron variant was running through, there were still people, even fully vaccinated, even boosted, that got COVID, but the rate of hospitalization and death was dramatically lower. And so the commentary that I would receive, and we saw this in the data as well, is even if you were boosted and you got COVID, you had milder symptoms. It didn't necessarily put you in the hospital. Now, there are outliers. It could happen, but for the majority, it reduced the severity of the illness. And we're looking to save lives. So at this point, I understand, like, the risk of getting COVID, you can still get it even if you're vaccinated. Because if you think about it, we're creating vaccines to attack or to protect you against a certain variant. Then the variant changes.
Right.
So we're chasing it, right? So we're
Just like the flu.
Yes, it's exactly that way. So we're not going to necessarily get the right prescription for the right variant all the time, because we're kind of in this race. And so what it does do is it does the same as the flu, offer a level of protection for us. Even if we do get it, you'll have milder symptoms, and it can potentially save your life. And that's what we want, right?
Well, and we are getting ready. Oh my goodness, look at the time.
I know.
We are getting ready to offer the second booster.
Yeah.
And I think it's great.
It's awesome.
I think
I want to hear about this book.
let's hear about your book. We have.
Yeah,
tell
great.
us about your book.
Well, I just want to show this book. It's called Broken. how the global pandemic uncovered a nursing home system in need of repair,
And
the heroic staff fighting for change.
Here
Yeah, absolutely.
Could you leave some and we'll count them and people could buy them?
Yeah, absolutely.
Okay.
So I wrote this book. I've been in well over almost 300 nursing homes across the country helping with this pandemic, and I really started seeing the same challenges everywhere.
Yeah.
And I wanted to tell the story from the nursing home perspective and give credit to our healthcare heroes in our nursing homes that often are left behind and their voices aren't heard. And so this really describes that and describes our challenges in long-term care and what we can do to correct those challenges for a healthier, safer environment.
So if somebody were to pick up the book, what would they hope to get out of it? Just perspective or strategy or kind of a little bit of everything?
Yeah, all of that. So really to understand, what we hear in the media is how horrible nursing homes are. That's what is blasted so often, right? And I want people to understand there are challenges in nursing homes for a reason, and many of those reasons are not even in their control. It's based on different regulatory or infrastructure, and so I'm trying to bring light to the true challenges and then what we can do and what we need our politicians to do to make changes and to make it safer for our loved ones. So it really is for the healthcare worker, but also the consumer of this type of healthcare for their loved ones and what they can do to advocate for change as well.
And don't you always think knowledge is power?
Absolutely.
And that's it. You never lose by reading something.
Right.
You really don't. And even if you go into it and go, well, that has nothing to do with me, you'll be amazed.
Yeah.
It really does.
So we'll have books they can pick up. Where else could they find this?
It's on Amazon. You can pick it up. It actually launched just a month ago, so it's great timing. It made Amazon bestseller in several categories.
Very cool.
And so it's definitely a much needed book.
Now, was a book something you knew you were going to want to do? Have you ever done a book? This is the first book.
I really felt compelled, almost obligated to write it because I was hearing the same story all over the country. And it was really a cry for help from our nursing homes. And I just felt like this story needs to be told.
Great.
And so that's why I took the time to do it.
Awesome.
Yeah.
Well, this show just flew by.
I know.
We could just keep going, and we need to have you back.
Yes.
We don't want another pandemic to let it happen, but we need to have you back.
Well, I want to talk about more of the solutions.
Yeah.
Yes.
We do talk about the problem, and that's important for people to have that awareness. But let's talk more even about the solutions.
Yeah, and I love that because ZoeLife is so based on prevention in trying to be proactive in your wellness, right? And so how do we kind of dovetail that into some of the clinical space of infectious disease?
I love that.
That's very cool.
Well, let's do that. So we'll schedule.
Okay.
Awesome. Appreciate you being here.
Yeah, thank you guys so much.
So nice to be in
It's our
person.
pleasure.
Yeah.
No masks on, at least in this setting.
know.
It's very
Can I say one thing to our best friends out there? I took my last antibiotic last night.
A lot of prayers for you.
I know our residents know that it's been a long 8.5 month process.
I don't know
So
how you've done it.
gonna get better now.
Yeah, you
That's
are.
awesome.
That's
Congratulations.
Thank you.
Perfect. Awesome. Well, thank you for being here again.
Yep. Thank you.
Appreciate it.